Hello, everybody. Welcome to this presentation. We are in the pilot phase of this study aimed to develop the therapy manual for identity-based transdiagnostic therapy for young people and depression. Our question is whether virtual reality would improve outcomes. The problem is clear. Depression and anxiety are the most prevalent mental disorders among both the general population and young people. Common psychological processes and high degree of comorbidity have been observed between these disorders. In the last 2 decades, several transdiagnostic treatments have been proposed as a more effective approach in usual clinical practice. None of these treatments is specifically targeting young adults and their unique challenges. They usually face major developmental challenges, individuating from their parents, forming and maintaining intimate relationships, gender identity and sexual orientation, completing further study and finding a job, and young people might be experiencing the impact of adverse events occurring in infancy, early adolescence, and during the COVID pandemic. All these issues might have interfered with the identity process that also characterize this period of life, and thus affecting their mental health. In addition, substantial difficulties have been reported in engaging young adults in the psychotherapeutic process, a key factor for its efficacy. Increasing the availability and effectiveness of psychological treatments can help prevent and reduce the risk of severe and chronic mental illnesses among young people, ultimately contributing to a more resilient and healthier adult life. To address this necessity, we propose identity-based transdiagnostic therapy, IBTT, a treatment modality created specifically for young adults, considering their attitudes toward treatment, attractiveness, engagement, and subjective perceptions of self and others. The incorporation of virtual reality in this approach may enhance the effectiveness and attractiveness of psychotherapy treatment for young adults by promoting better engagement. Identity-based transdiagnostic therapy is based on personal construct therapy. It is highly personalized by focusing on their construal of self and others. Although it takes into account the specific symptoms and challenges of each patient, its more distinctive intervention is an immersive exploration of the person's schemas as applied to the current self, the ideal self, and significant others, using, for this exploration, virtual reality. Among these schemas or constructs, Kelly suggested that the core constructs had the function to preserve the sense of continuity of the meaning system. They constitute the person's identity. We propose that successful interventions end up reconstructing the patient's mental map, that is, the patient's construct system, for which the core constructs are the key piece. The repertory grid is a semi-structured interview created to elicit the person's constructs and analyze its content and structure. Here, we have an example of a participant. The administration of the repertory grid involves 3 stages in the context of a structured interview. First, a set of 10 to 20 elements representing the self and significant others typically mother, father, siblings, partner, friends, is selected. You can see in this case, in the columns, these elements. You can notice that a non-grata person is also included. It means someone whom you know but you don't like. And the ideal self is also very important. How I would like to be. In the second phase, a diet of elements, for example, father and mother, is selected, and the individual must compare them in terms of their similarities, perceived similarities, and differences, perceived differences, according to the subject's view. In the grid example of Aina, both parents were seen as loving. Loving is her word, her construct, not provided by us. Both parents were seen as loving, and then she was asked to provide a label for the opposite. Careless, she said. Additionally, one or more perceived differences between the two elements were explored, so that the mother was seen as ambitious, while the father was described as purposeless. The person is encouraged to provide more differences and similarities, and then a new diet of elements is selected, for example, self and brother. This process of selection of diets of elements and construct serves for construct elicitation, and it's repeated until all elements appear at least once in the comparisons and the subject does not provide new constructs. These personal constructs, which reflects the interviewee's subjective views rather than previously set of standardized items like those of questionnaires, are displayed in the rows. You can see them here. In form of the grid form, where the elements are represented in the columns. Finally, the person rates each element in terms of each of the elicited constructs, employing a 7-point Likert type scale. For example, a score of 6 is given to the element father for the construct ambitious purposelessness. Sorry. Here it is. Here is the 6. And a score of 3 is given to the mother. You can see it here. Mother has a 3. Meaning that she is perceived as a little ambitious. And thus, the grid data matrix is created. Every cell is a comparison, is the rating of one element according to the two poles of the construct. This process was done using pencil and paper for decades, but now we created Amy, a digital platform to leverage this process and potentiate its effects. The grid data matrix is analyzed by Amy, Explore Your Meanings, to provide an automatic report with the results. For example, both unsatisfactory and satisfactory characteristics are identified. The latter reflect an interest in positive psychology, identifying strengths. For example, she sees herself as loving, passionate, humorous, artistic, assertive, etc. The mathematical analysis of the grid data matrix provides measures such as self-ideal discrepancy, which can be considered an indicator of self-esteem, or polarization, which express the degree that the person uses interpersonal dichotomous thinking, among other measures. Using multivariate statistics, Amy Explore Your Meanings creates a 3D image of the mental map to be visualized as we are doing now in a screen and navigated with the mouse. This map can also be explored immersively using a virtual reality system that creates a powerful experience of self-exploration and self-awareness for the patient. Amy has also the capacity to detect implicit dilemmas, also known as implicative dilemmas. These are a type of internal conflict among schemas or constructs. An implicit dilemma is found whenever a personal construct expressing a change that is desired, expressed by the discrepant construct, is associated with another construct with an undesired change. She wants to be approachable, according to the discrepant construct, but that would make her naive. Approachable is associated to naive. These dilemmas hinder the patient's personal development and block the therapy process. She doesn't want to be naive, but she does want to be approachable. And the two things are linked. One thing implies the other. The therapist guides the patient in exploring this conflict via the virtual reality visualizations for them to see potential paths for solving the dilemma and fostering personal growth. We have become familiar now with some of the ingredients of identity-based transdiagnostic therapy. Rather than narrowly targeting symptoms, the main focus of IBTT is the promotion of self-knowledge by analyzing the person's meaning system and identity. Based on case formulation, IBTT includes work with implicit dilemmas, using techniques such as analysis of mental prototypes, ABC Chudy's technique, and Magic Wand, the two-chair dialogue, but also includes other techniques such as not related to dilemmas, such as laddering for exploring core construing, family work on family constructs, analysis of personal goals, and an immersive exploration of the mental map that increases self-knowledge. Our main hypothesis is that IBTT will prove its efficacy by reducing anxiety and depression symptoms to a greater extent than a well-established transdiagnostic treatment, which is the unified protocol. We also expect greater improvements in psychological functioning, well-being, self-esteem, and metacognitive capacities. To test this hypothesis, we designed a single-blinded, multi-center randomized clinical trial with two parallel groups, comparing IBTT and the unified protocol based on CBT. We work in collaboration with several mental health centers. We plan to recruit 138 young adults with main complaints about depression and anxiety. Assessment conducted at pre-therapy, post-therapy, and 6-month follow-up will monitor symptoms, psychological functioning, well-being, self-concept clarity, metacognitive mastery, life satisfaction, and the quality of the therapeutic alliance. Additionally, with a qualitative interview, we seek to grasp the common and specific potential change mechanisms. Now that the project has been approved by the participant centers' bioethic committees and registered, we are enrolling a small number of patients in a pilot phase to evaluate the utility of the IBTT preliminary treatment manual. Referring professionals will provide a link to potential participants that includes an explanation of the study, informed consent, and questionnaires, all of these online. For the analysis, we will use linear mixed models with the intention to treat sample and clinical significance to compare treatment effects in the two arms. Our technological innovation using virtual reality to explore personal identity aims to raise the current level of efficacy of the treatment of young people by increasing their engagement in the psychotherapy process. We are also personalizing all the process. Not only the virtual reality scenario is unique, depicting the person's mental map, but also the interventions. Well, we think that AMI is the only virtual reality-based tool for self-identity assessment and exploration. This approach avoids technical jargon and is inclusive of the patient's preferred terms, is personalized to each patient, and in the virtual reality immersion, patients view themselves from the first and third person perspectives to gain a meaningful understanding about self and others. Thank you very, very much for your attention, and we hope you enjoyed the presentation.